We have a packed agenda today. So I want to start by introducing myself and then having each of our panelists introduce themselves. I'll go through the structure high level and then we'll dip into the questions. So I'm Stephanie Apia. I'm a vice president and founding member of the Mason Alumni of Color Network. Just want to welcome all of you here tonight and say thank you for joining us for our Getting Down to Brass Tacks discussion about the vaccine. I say proudly that I am a recipient of the vaccine on Monday, so I'm very excited to talk in more detail about it and learn from the experts that we're going to hear from today. And I just want to hit 2 points and then I'll turn it over to our panelists. The first is the mission of the Alumni of Color Network, which is to embrace diversity with respect to all Mason alumni who identify as people of color. We recognize that many of us come from marginalized backgrounds or have had a marginalized experience, and the pandemic has driven some of those marginalized experiences to the front and some of those inequalities to really the media main stage. And so I'm sure many of you have heard this week, our Asian American and Pacific Islander brothers and sisters have been dealing with huge amounts of oppression, high numbers of attacks. And so we want to start this by saying we stand with them, we support them. And for each of us who has an ability to make an impact, we want to do so in support of them. One of the things that we're going to focus on today is the number of lives, particularly people of color, who are impacted by COVID-19. As many of you know, it's been over a year, can you believe it, of the pandemic, and people have lost loved ones. Hundreds of thousands of Americans have lost jobs. Many more are struggling financially. And the biggest thing that we knew was communities of color and those with low income were hit the hardest by the pandemic. So today's program is going to talk about some facets of the pandemic as an attempt to counter misinformation, to better understand the reach of the pandemic, and to understand our role as business leaders in a world that's impacted by this pandemic. So I'll turn it over to Mr. LaMont Byrd, if you will please start us with an introduction of yourself and a little bit about your background.
Okay, thank you, Stephanie. Can you hear me okay? Yes? Okay, good afternoon, everyone. My name is LaMont Byrd. I want to thank you for inviting me here to serve as a panelist today. I am the Safety and Health Director at the International Brotherhood of Teamsters in Washington, D.C. I'm an industrial hygienist by training, and most of my work involves, of late has involved providing technical, regulatory, and policy support to roughly 1.4 million members across the U.S. Concerning COVID-19 and other occupational health and safety hazards that they may face. Thanks.
Dr. BJ Subramaniam, maybe I said it right.
You got it, Stephanie. You did a really good job. My name is BJ Subramaniam. I wear multiple hats. I am a practicing pulmonologist in Williamsburg, Virginia. I'm also the head of our clinical research division, including doing research on COVID and multiple other things. And thirdly, I provide consulting services for some large industry partners in the region, especially when it comes to COVID and other pulmonary issues. And I just got off of work, so I'm still in scrubs.
And Ms. Dawn Wayman.
Good afternoon. I want to thank you for inviting me to participate today. So I'm an infectious disease epidemiologist, did most of my research training at Johns Hopkins Bloomberg School of Public Health, and have since then worked in local and state health department settings and done some health disparities research. I'm primarily interested in looking at how community level risk factors influence an individual's risk for disease outcomes. So thanks again, and I'm excited to share in today's conversation.
And just for my own notice, do you all want to be referred to by first names or by titles as we address the questions?
First names from my standpoint.
Yeah,
first name is fine by me.
So we're going to break this discussion into 3 sections. We're going to talk about medical perspectives, So VJ, you'll have some questions going first. We're going to talk about dispelling common misconceptions. Don, those will be addressed to you as well. And then we'll talk about the vaccine and ramifications on access to inequality, reticence of people taking the vaccine, and additional misinformation. And so Lamont, I'm going to lean on you. So to get started with our medical perspectives, we just want to ground ourselves in the facts. As we go through this, again, we want to hear from the experts, not only your expert opinion, but perspectives that you can add as you are literally on the front lines dealing with the pandemic. And we wanted to make sure that we are not looking on this call with this group to debate the scientific recommendations of global health experts, but we want to break down the facts, particularly for communities of color who've had a lot of questions about the vaccine. And while we know that there are currently 3 approved vaccines in the United States, Pfizer, Moderna, and upcoming Johnson & Johnson, many people have had fears about potential illness, side effects, and whether or not they could still transmit COVID-19 to others. So we know for the vaccines, there was rigorous vaccine testing, there was rigorous safety standards and trials, a large amount of funding from people all over the world in the United States to push this to market in record time, and that there's long-term efficacy that continues to be evaluated, and people are continuing to learn about risks of the virus itself, its long-term effects, and some risks of the vaccine. So for more COVID facts and specific information, I highly encourage you to visit cdc.gov. I know for my own team, I have a team of 300. We push them to the CDC site every day. So those of you who want to learn more, that's a little homework for me. So VJ, we'll start with you. As a pulmonologist, can you talk about COVID-19 as a disease and what it does to the body?
It's, I'm sure a lot of people have already learned a lot about some of the basics, but it's a virus that seems to have a predilection to causing problems in the respiratory tract, primarily in the lung, even though we're hearing about a lot of people having problems in their toes, the smell, the taste. The biggest problem we're seeing with it is it causes an equivalent of a really bad pneumonia. And with bacterial pneumonias, there are antibiotics we use to treat it. With viruses, the really goal is to provide support and hope the body can heal itself. This particular virus, unfortunately, because of the predilection to the lung, and we're seeing a lot of it really affecting the African American and Hispanic communities. When I looked at one of our ICUs recently, almost everyone in the ICU was a middle-aged African American or Hispanic person on a ventilator. We don't have, and this is some of the stuff that Dawn's groups, I'm sure, are looking at as why is it hitting those people particularly, but I've had plenty of patients, and we actually had some of the first deaths in Virginia were local and people that I knew. And, it affects people that you don't even think you're going to affect. The virus actually will transmit between one host to the second host, usually before the symptoms even really start. And that's pretty classic for a virus. Usually there's about a day or two of transmission before people even get symptomatic. So I can tell you one of the first cases we heard about was somebody who transmitted it to their grandparents, and they were asymptomatic. They came to visit for Father's Day, about a year ago. The grandparents been doing everything what they should. The grandchildren, unfortunately, weren't playing as well as the grandparents were. They ended up giving it to them, and they both got very sick from it. But it's a virus that we're learning a lot about. Things change day by day. The amount of information that comes out of CDC is immense, and trying to parse through that is a full-time job for sure.
And so as we are seeing the vaccine, come to market, so I'm in Detroit, Ford Field, FEMA is giving the vaccine to anyone who will come. There's still some fear if we get the vaccine that we can give people the virus. Could you talk a little bit about what it means to get the vaccine. Is the immunity just for me? Is it something that I still can get other people sick? I think that's still lingering out there.
And and that data is actually still coming about. What we're finding, especially with the 2 mRNA vaccines, and there's 3 vaccines out there that are currently approved. There's Pfizer and Moderna, which are both mRNA vaccines. Then there's a JNJ vaccine, which is more of a classic style vaccine. What they're finding, at least on some preliminary information, as the risk of transmission, especially with the mRNA vaccines, is significantly less. When we typically do a clinical trial, we evaluate 2 years of data after everyone's completed. We're kind of looking at real time. I mean, right now we're looking at data from people that have been vaccinated for about 6 months. So we are seeing a significant decrease in transmission, especially with those 2 vaccines. They are seeing some of it with the JNJ vaccine. The biggest thing they're seeing with the JNJ vaccine is it really decreases people from getting really sick, hospitalized, and dying, which is a key to it. Even with the vaccine, masking is still going to be around for for a while. I'm hoping by the end of the year it'll get better, but people are going to be in masks. But right now, if you have an option of taking a vaccine, take whichever one you can get. I took the Pfizer vaccine. Now I've been vaccinated, fully vaccinated for about a month. We were not part of the first rollout. I know a lot of people were afraid to be part of the first rollout. And when they were asking me about it, I go, well, there's been 10 million people vaccinated, and you're not hearing about a lot of people having side effects. And, the percentage of side effects that we're seeing are less than what you would typically see with people complaining about the flu shot.
And when we get the vaccine, so it sounds like we're going to be wearing masks for a long time. It's been a year, but we'll keep wearing them. Can we hang out with other people who've been vaccinated? I think that's the number one question from my team is, if we're all vaccinated, can we all hang out now? Can you have a barbecue? Like, is life back to normal, or is it still phases of these precautions that have been outlined?
The answer is yes, within reason. I can tell you that we saw my father and my sister, who have all been vaccinated. We saw them for the first time without wearing a mask. I am in a rare situation. My office voluntarily is 100% vaccinated. So we actually get to have lunch together with each other without wearing a mask. So current CDC guidance says, yes, you can associate with other people that have been vaccinated without a mask, as long as people are asymptomatic. And we're going to learn more and more about that. And the other thing that we're happy about is, if you have a COVID exposure, you've been vaccinated, you don't need to quarantine if you're asymptomatic. So, we have a lot of my patients. It's the next 3 months, there's going to be a lot of people seeing their grandchildren for their first time in almost a year.
For LaMont and I, for our teams, that's a game changer. We have a lot of folks that we're losing from the workforce who are quarantining for 10 to 12 days. So
yep.
That's
and that was one thing with some of the consulting I was doing, is we were working on protocols to help decrease that. But now being able to tell people, hey, you can actually work in close with your colleagues and not have to quarantine with an exposure, as long as you're asymptomatic. And, just everyone needs a little bit of a break, and to be able to actually have lunch with your colleagues and, friends, and just actually hang out and de-stress a little bit.
So then I guess the other piece, if in this new world, you can begin to have a lunch with someone or talk to someone, there's a question of, so then will there be more at-home testing so people know, oh, I'm asymptomatic, but I was carrying COVID? Because is there a goal, or is it realistic that we can fully stop the spread? Or is COVID just always going to be around?
The at-home testing, with any testing, we're going to talk about, there's 2 real different types of testing. There's what's called antigen testing, which is quick. You can go to pretty much most urgent cares and get an answer within 15 minutes. Most at-home tests are going to be antigen tests. They're fast, but sometimes their accuracy is not where we want it to be. I can tell you, I will never make a medical decision or a clinical research decision based off of an antigen test unless it's, a positive antigen test, I'm going to believe. A negative antigen test, I'm not going to believe if I have a high clinical suspicion. If, for instance, you've got some sniffle type stuff that you think could be a cold, could be COVID, you have a negative antigen test, I'm going to tell you to still quarantine. Again, if you haven't been vaccinated, or get a PCR test, which is considered the gold standard. The PCR test, unfortunately, typically takes anywhere between 12 and 36 hours to get the results. There are a few tests that can be done quickly, but most of them are a little bit more time consuming. A negative PCR test, I would actually favor the results on that one. A positive antigen, positive PCR, I'm going to take that as positive unless I have a significant reason to think it's a false positive test. The antigen tests have actually never been studied in asymptomatic individuals. So that's one thing you do have to be careful with, is there's no data saying that they're effective in that population.
So then, we're all hyped up about vaccinations, but Don, there's communities that are not getting vaccinated in high numbers. And so what does this mean for communities of color? If the standard is to get a vaccine to go back to work or participate, where are they being left out?
Right. So I think, in short, any community that has high vaccine hesitancy and low vaccination rates means that the virus will continue to spread, and there's the potential for increased burden of disease. I think if we think about some other public health crises, if you will, if you think about like measles or mumps, we don't really see widespread disease, right? Because enough people have decided to get vaccinated or will have their children vaccinated. And so there's not the ability for disease to take off. And so I think the story will be no different with COVID-19. It's a virus that has shown itself to be highly transmissible and can lead to severe illness or death. And so if people do not get vaccinated, it will continue to circulate in communities. I think the other thing we have to be mindful of is that in communities of color, we know that individuals are more likely to have underlying health conditions like diabetes and obesity. And we've seen that this leads to more severe illness and various ages with these underlying conditions. And so low levels of vaccination will just mean that virus spreads, disease continues to manifest, more deaths will occur. And unfortunately, I think it also means that people will not be able to return to normal social patterns.
And so you brought up a good point, and maybe I throw it to both of you. Do these underlying conditions also create a reason where people shouldn't get vaccinated, like having diabetes or having lupus or an autoimmune disease?
I can answer that one. The original studies did exclude pretty much every autoimmune disease. It did not exclude diabetes. It did not exclude hypertension. I can tell you, in my population, and I do sleep medicine and pulmonary, we're telling almost everyone to get vaccinated. There's a very, very specific couple of disease states where I'm recommending they do not get the mRNA vaccine, but they get the Johnson & Johnson vaccine. But I can tell you, out of 5,000 patients, we'll say, I can think of a handful of people that I said, hey, you should probably get this vaccine. Everyone else, I'm telling them, just get it. They excluded children from the studies. They excluded pregnancy from the studies. But there's research out there saying that people who were vaccinated, they still had children. They were able to get pregnant. There was an article in the news that there was a mother who did receive the vaccine, and the antibodies were actually passed down to her child. And what I tell a lot of my patients is, if you don't care about yourself, get vaccinated for your loved ones, because you don't want to kill someone. I'm going to tell you guys a story of two friends of mine who are very bullheaded. Everyone has friends like this. We were outside, and this was probably about 6 months ago, 4 months ago, and we were all talking. We were outside. We were socially distanced. One of them was just recovering from cancer, but otherwise very healthy. The third person was like, I don't believe in this. I don't believe in this, and I don't believe in that. And I said, well, if you die, it's on you. No one's going to care. But if you turn around and infect him and he passes away, does that mean you get brought up on charges for manslaughter, or is that murder? And that brought the point home to him. It was kind of mean, but sometimes you need to say that.
I guess the other piece, and maybe that goes to the misconceptions, is what we've heard, and I'll say it plainly, is people are citing the Tuskegee experiment as like a reason to not get the vaccine. Can you elaborate on what that actually was, and if those lessons went into any vaccine practice? It's being cited a lot as a reason for people of color to not get the vaccine.
Don, do you want to answer that, or would you like me to?
Yeah, I can talk a little bit about it. So the Tuskegee experiment is different. It's a different set of circumstances, right? So people were not treated for disease, for syphilis, and they thought they were being treated. And so it became a natural history study of the disease. And there was deception, right? But I would say that there are a lot of ethical measures that have been put in place since studies like this. The Tuskegee syphilis study is not the only study that has taken advantage of research participants, if you will. Dr. Bill Jenkins, who has passed away at this point, went in and really exposed what was happening in the Tuskegee syphilis study, and really made sure that marginalized people were never treated like this again in research. And so for these vaccine studies that have taken place, there has been great oversight at varying levels. And so I don't think in this instance, we could use the Tuskegee syphilis study as an excuse to not be mindful of some public health choices that we make on a personal level.
And then as we think about, and thank you for clarifying that, it came up a few times, so just wanted to put it out there. When we think about getting communities of color to engage, the thing that's also tossed around is this concept of herd immunity and us needing to get herd immunity. What is herd immunity, and what does it mean for a community of color?
So herd immunity certainly is not a concept that's limited to a community of color. It's the idea that there's enough protection in a community, and it could be from natural incidents of disease or through vaccination, but there's enough protection in the community that a virus or an illness is not able to affect large numbers of people. So like I mentioned, measles earlier, that's a perfect scenario. Smallpox has been eradicated. We don't see polio in the United States. These are all illnesses that are no longer able to take root because enough people have built up a resistance to these things that we have what's called herd immunity. I can't tell you what a percentage would be, right? So we've heard numbers tossed around like 70, if 70% of the population is immune, then we will reach the level of herd immunity. This is a novel virus. I don't think we can say with absolute certainty what is the ratio, what's the number we need to hit to ensure herd immunity. But we seek to get as many people vaccinated as possible because we know this will then suppress the virus's ability to change, to mutate, So we won't see other variants, hopefully, and we won't see disease in the general population.
So one more question, and I think, Lamont, this one is for you and Don together, and then we'll check the chat box. So the other question that's outlined is, what are the programs or services that exist to assist people with health disparities with gaining vaccine access, with registering, and then cost or information? There were some misconceptions that the vaccine costs money, and so could you talk about that as well?
Yeah, sure. I can start off. Yeah, and thank you for the question. There's been quite a bit of funding and support pushed into providing these kinds of services. I think the doctor referred to FEMA earlier. I think FEMA and the Health Resource and Services Administration, both are federal agencies that have been provided with funding to supply vaccine to community health centers that serve underserved communities. They're community-based organizations, our faith organizations, sororities, fraternities. They all are providing assistance to individuals who have limited or no access to computer equipment to register online, or individuals who may have difficulties using the online platforms. I know that the Black Nurses Association conducts vaccination events. Of course, our local public health departments. And then I have to put in a plug for labor unions, a large number of labor unions that represent significant numbers of Black and brown workers are providing assistance to their membership and to their families by providing training and information and assistance for registering for vaccination. And they're also providing facilities where vaccinations may be administered. So those are a few services that exist for folks who are impacted.
Yeah, the only thing I would add on to what Lamont has shared is an informal network for helping to get access to vaccines. And these are through social media. Like, there are vaccine hunter groups, some that are specific to providing appointments from marginalized populations. And it's amazing how these networks are working. In Maryland, I've seen a network that has flyers that they post in neighborhoods. There are people who have created forms for individuals to fill out and really have band together to help get people access to vaccines. I believe Lyft, it may be Uber, but I believe Lyft is providing free rides to get vaccines for individuals. So there's this informal network that's bubbling up through social media accounts. And I think I know in Northern Virginia and Maryland, they're definitely prevalent.
Also, probably in about 6 to 8 weeks from now, there really will not be a vaccine shortage. Everyone is panicked for a vaccine. It's going to get here, and it's going to get here quick. I'm seeing the floodgates open. I saw 25 people in my office today, and I would say at least 18 of them had received either both vaccinations or at least one vaccination. The other thing, like Lamont said, the labor unions and the employers they work with, one of the local employers that I consult with have vaccinated over 1,000 people on Monday and Tuesday. And as long as they can get vaccine, they're going to vaccinate as many people. And they are a corporation that has a high percentage of at-risk population, and they are just getting it to everybody. And the labor unions have been extremely supportive of it.
So I'll pull 2 questions from the chat. And Vijay, I think these are directed at you. And so one was, what are the specific conditions where if someone has that condition, they should avoid the mRNA vaccination?
I've been telling patients with basically neuromuscular type of disorders, such as Guillain-Barré, things of that sort, to really speak to their neurologist and I've been kind of pushing them over to the JNJ vaccine. My cancer patients, my patients with autoimmune disease, general stuff like that. No, just get whatever vaccine you can get. But there's a few, and it's actually listed on the CDC website. Guillain-Barré is one of them, absolutely. And like I said, a lot of the ones that I've been telling are the ones where they're neuromuscular disorders. Myasthenics, Lou Gehrig's, and the Guillain-Barré are probably the three that I tell the most.
And then Lamont, the next one is for you. It says, do you foresee large employers continuing to be lenient with recovery time for employees as that COVID legislation expires? I know the Rescue Act just came through, so many of us who work for large employers are excited for more funding, but it won't be forever.
Yeah, that's a good question, and what we're seeing is, and I work for a labor union where we represent workers who are typically employed by large employers. In a union environment, we've been able to negotiate contract language or memorandum of understanding to allow for that recovery time. But in other mid-sized, smaller, and some non-union facilities, it's still a problem, and it's particularly a problem in industries that are classified as essential, where there are large numbers of Black and brown workers. I'll use the warehouse industry, for example, or grocery warehouses in particular. These workers are working extremely long hours. The employers are having difficulty with turnover and being able to recruit new hires. So there's a great deal of pressure for these folks to come to work, and even in situations where may not be feeling so well. So, there's still some problems there, and I think that. Even with additional funding being provided, I just think if the pressure continues, there'll be continued pressure for people to show up for work despite, how they feel.
So when we go to the next section, the big questions that came through were about reticence and misinformation, and then what about access with inequality, and then you guys, I'll probably hit it at the end about Facebook and how much misinformation is out there. So BJ, this first question is for you. How are communities of color getting information and making decisions about their health? And how has the medical community been working to build trust with communities of color?
Honestly, it's been pretty poor right now. We're trying. In Williamsburg is the percentage of communities of color is not anywhere near as much as it is in the larger cities. What I've actually found is actually talking to leaders in the communities, and I'm going to call them elders in the communities. They don't really hold a kind of a role, but they're a role model to the younger population. I have a lot of the different churches, the leaders of the churches, almost all of them, maybe a little coursing, but have been vaccinated or willing to get vaccinated. And once you see a couple of your friends or your colleagues get vaccinated and the leaders get vaccinated, that is really what helps get the word out into the community. Interestingly, the clinics around here that provide care to the uninsured have very easy access to vaccine. They actually had access to the vaccine before we did, but it's hard to get people to come in and take it. But I can give you an example of 6 weeks ago, or when the vaccines are first starting to come out, the number of individuals of color I had that wanted to take the vaccine was not much. I'm having to argue with them the whole time, but over the last week or two, almost everyone that's come in, I go, have you gotten your vaccine yet? They said yes, or I'm on the list. And these are individuals of color. Most of them are older. Most of them have risk factors. Most of them want to see their grandchildren. And it's seeing the grandchildren, the part that's moving them more than anything else.
So Lamont, I guess similarly, and my speaker just died, so hopefully you can hear me. Okay. Given the levels of skepticism, what advice do you offer for people who are looking at mass transportation and then public facing businesses?
I think I think that having accurate, up-to-date information is critically important. I think that business leaders and community leaders and other people who have respect in the communities have to redouble our efforts to provide individuals who use mass transportation, businesses, or workers who work in forward-facing businesses or work in the transportation industry. They have to provide them with some good information because there's so much misinformation in circulation, and there's a lot of confusion or just real concern out there. I think it would really be helpful if we, because the misinformation has had, several months to kind of marinate, I'll say, we really need to flood, our pub with flood, with information through public service announcements. Like I say, using these trusted individuals in the communities to promote employing safety measures and vaccinations. And the PSA should be in print, podcast, radio, television, just flood the market to try to undo some of the damage that's been done. I think that the mass transportation agencies and employers in those industries should implement policies that are based on sound science and convey that information to their employees and to the users of their services in a way that's accessible and understandable. And they have to be enforced strictly. I would like to pause here and just say that for workers who are responsible for enforcing those policies, as we've seen many times over, these folks may be subjected to verbal and physical attacks. So we think that businesses should take the necessary steps to protect those workers and provide those workers with training on how best to respond. And I think those are just kind of a few ideas that come to mind.
And then Don, I turn to you and I ask, to Lamont's point about employers creating a safe place for workers to hold each other accountable and to stop the spread of misinformation, what are the expectations for employees and then for those of us who are business leaders to ensure we're promoting a culture of trust and transparency so people will stay home when they're sick and they will be transparent if they have symptoms?
All right, I think we have to create a new normal, right? Because we work in environments where Lamont kind of referred to it, where people have to show up when they're not feeling well. There's an expectation from employers, and there's the risk of, do I go to work sick, potentially infect other people, or do I lose my job? We're now at a place where we have to change that norm, and employees have to trust that their jobs won't be at risk. And business owners have to assume that their employees are telling the truth, that they're not just trying to get over. I think returning to work post-pandemic is going to require things like hanging signs that speak to this code of conduct that we have to hold one another accountable to, right? So we have to say explicitly that this is a space where everyone will wear masks, and this is a space where everyone will adhere to some distancing rules. And if it's violated, you have the right to say to a person, hey, you need to put your mask on because you may be putting me at risk. We need to create an environment where people know if they're exhibiting symptoms of COVID, or if they know they've been exposed to a person who was COVID positive, that they don't come to work, that they just know that's a consequence of their potential exposure or their potential decision that they made. I know Dr. Vijay referred to the CDC guidelines that talk about how we can gather in community. From the public health perspective, I'm always going to have a bit of hesitancy about how safe it is to gather in groups with people who you think you have an agreed to set of rules, But you just can't be certain that everybody's doing everything that they say. So even after leaving this safe bubble, I think it's important to be mindful of who someone goes around, because you don't want to unknowingly place people at risk. I know personally for me, I was around my family for the first time 2 weeks ago, I guess, without a mask. And in full disclosure, I've been vaccinated fully since October. I was in the vaccine trial. And before I went around them, I had a test. I knew I hadn't been exposed, but it was something I felt I needed to do to ensure that my family knew I was not trying to put them at risk. Business environments are going to have to create those same types of measures. And I think it has to come from the top down and the bottom up, right? Because if one group feels that they don't have to have this agreement to protect one another, then it falls apart. But if both employee and employer are committed to creating safe workspaces, I think that's how we move beyond this pandemic. It's still not going to be comfortable for a little while. We're still going to have to wear masks. We're still going to have to distance. We still may have situations where everybody on the staff cannot be at work at the same time. We'll get there. I mean, we've made it a year. We will get there. But in the meantime, we need to have some standards in place and some courtesy rules in place.
And so then we create a safer work environment. People feel the ability to hold each other accountable, but we still have inequities in facilitating the vaccine itself. And so LaMont, Joe Biden came out very publicly and said, by May 1st, every adult over the age of 18 can get the vaccine. What does that look like in reality?
Well, I think that as Dr. Vijay indicated, there's more vaccine available and a lot more is coming down the pipeline. And we think that that's a very, very good thing. And we think it'll help to overcome some of the challenges and obstacles that many people of color have regarding actually receiving vaccination. But simply having more vaccine available won't address all of the challenges. Registering and scheduling is still going to be a significant challenge for many people of color. One thing, if I could mention, when I think about the essential jobs or essential industries, they disproportionately employ people of color. These are the people who've been working during the pandemic. And so I'll use truck drivers as an example. Truck drivers and Teamster drivers, they typically work 60 or 70 hours a week, up to 14 hours a day. They travel distancing. Both of these issues complicate scheduling. If they have to have 2 doses of vaccine, that makes it even more difficult. Many drivers don't earn money if the truck isn't moving. So getting a vaccine or sitting for a vaccine presents a financial disincentive. And these folks, a lot of the owner operators operate at pretty thin margins. So, if they're allowed to get vaccinated on the clock, the time spent getting the vaccine counts against their regulatory imposed driving window. So again, that's a financial disincentive. The fact that there may be some minor side effects, they may not feel so well for a day or for a few hours, that's all well and good. But if you're operating a heavy truck that's maybe loaded with hazardous materials, do you really want that individual out there operating at all on that particular day and possibly presenting safety hazard to himself or to those who share the road with him? But if he takes off work, chances are he won't be paid. So there are still these challenges that these folks, they face. On the warehouse side, another essential industry, I got a call today. There's an employer, warehouse employer, that actually is encouraging employees to get vaccinated, but they're not giving them any time off to go for their registered, to meet their registered appointment. And if they take off, they're docking their pay. So these are the kinds of financial, mainly disincentives to getting vaccinated. And then I've mentioned, I think we've talked some about not having access to computers, broadband, and those kinds of issues. And then where the vaccination centers are located may not be in close enough proximity to brown and Black people to get ready access because they don't have easy access to transportation sometimes. So those are some barriers to vaccination that exist and will continue to exist even as more vaccine becomes available.
I think if I can just say one thing to back up LaMont, another concern that I've heard in the community, and I won't say it's overly prevalent, but I've heard it, is a concern with going to mass vaccination locations, right? So there's this idea of, if you're going to give me a vaccine, don't give it to me in a football stadium parking lot. I want to be in the doctor's office, or I want to be in a hospital. There's a sense of safety and security that people who are brown and Black, they need that sense of security. And so that is a barrier, I think, as well, particularly in some populations that really need to be vaccinated. They are individuals with underlying conditions. They can't take many risks. That's a concern that I think we have to be mindful of. And hopefully, as more vaccines are rolled out, especially with the J&J with different storage requirements, physicians' offices will be able to distribute more vaccines. But we just know that these are real concerns that are present in our communities.
And the J&J vaccine is really kind of a game changer because of the storage issues. I am part of I think we have 200 providers in my group. We were actually not allocated any vaccine because of, they didn't think, we have 225,000 active patients. They didn't think we had the infrastructure logistics to provide the vaccine appropriately. And, to be honest, I agree. The -80 freezers, we have 2 of them in our group. I happen to have one of them for my research division. I was actually glad when they went to the pharmacies. I actually think, and this is just goes for most vaccines, when you can get your vaccine on your corner pharmacy or your where you go to and the person, or you get it with your physician's office, which is what's going to happen with the J&J, you're going to see a lot more people getting vaccinated. What I'm seeing is the Pfizer vaccine is really right now going to large institution and large employers. Lamont, you've probably seen this too, that all of a sudden one of the companies I consult with, they've been trying for months to get vaccine. All of a sudden, 5,000 doses of Pfizer showed up because the health departments in the smaller community places are trying to move to J&J. You can vaccinate twice the number of people in the same amount of time.
And so then, large employers are now getting it. Is it going to be a thing where to go to work or to travel, you have to prove you have immunity or have some kind of green passport that's like, I'm good to go before you can go places? Have you seen guidance leaning in that direction?
Well, yes and no. I can tell you from a couple of things. One, I don't think it'll ever be mandatory to be vaccinated to go to work. Their international travel, and it's been there for a while. If you want to try and sneak off to the Bahamas, you either need to show negative test or vaccination. There are companies where to get on a cruise ship now, they're going to require proof of vaccination. We don't require vaccination in our office, but the way our current policy is if you are not vaccinated and you've been given the opportunity to get vaccinated and you have an exposure, yes, you do have to go home and quarantine. This could be a point of contention. We do not pay in that situation because there are guidance out there that if you've been vaccinated and you're asymptomatic, you do not need to quarantine.
Yeah, if I could jump in, and I would agree with Dr. Vijay that I don't think that we'll see a federal mandate for vaccination. But I do know that some employers are developing policies because we're going to have to negotiate with them on these about these policies to work in a particular facility. You have to be vaccinated. I know that there's some EEOC protections that are available to workers who have legitimate medical conditions or religious conditions that preclude them from getting vaccinated. So they wouldn't necessarily lose their job, but they just may not get an opportunity to work in those situations. And so this is something that, as this develops, I think we are these are battles that we'll have as we move forward, I think, but I agree. I don't think we'll see any kind of federal mandate that there will have to be mandatory vaccination.
And this vaccine is going to be very similar to a yearly flu shot. I think everyone is expecting that there's going to have to be some booster or some new concoction every year. And that's what they do with the flu. They look at what are the possible strains that are going to cause problems, and they put that in the flu shot. So we'll probably be getting a separate COVID shot every year. And I know kind of in our industry, you are not required to take the flu shot. You're not required to take the COVID shot. If you do not take them, you're wearing a mask from the minute you walk in to the minute you leave. If you're showing signs of symptoms, you're not coming to work. If we catch you at work with symptoms, you're in trouble, because you're exposing other people that are significantly at risk. So I suspect you'll see similar rules, maybe not to that extent, come across from employers. Actually, I was surprised, LaMont, you said that. I didn't know any employers were actually trying to force vaccination.
Yeah.
Yeah, I mean, as an employee of a large employer, the discussion came up. And so my team members, similar to Lamont's, are union team members who had a fear. And we started, to Don's point, I was asking, what are the barriers to people of color? And so would a policy like this now disproportionately affect people of color? Here, a lot of the vaccinations are in your car. A lot of my folks don't have a car. So is it setting them up to be left out of opportunities? So then I guess here's another question as a business leader. Is it an uncomfortable position to be the ones who are advocating to people who are reluctant? And is it our place? I know for me, I don't want anything to happen to my team members and coworkers. And so I've been saying I'm pregnant, I'm getting the vaccine, but is it really my place? I mean, it sounds like, BJ, there's a lot of health considerations as well to getting the vaccine.
To be honest, if you care about your teammates and you care about your family members and their family members, it is absolutely everybody's place to push the vaccine right now. The health considerations that could happen because of getting the vaccine are so infrequent. We've heard a few people dying around the time they get vaccinated. For every person that we've heard that about, there's 100 to 200,000 people that we know have died from COVID. So, yeah, we push it. We push it hard. And I can personally tell you, when this all first came out, I said, let's wait. Let's get a couple of weeks. Let's get a month of data out there. And yeah, after the first 1 million or 2 people were vaccinated, we were really open about it. And the employers, the large corporations that I do consulting with, they're really pushing the vaccine. And I think they're looking at the safety and benefit for their employees, and also keeping the doors open.
Stephanie, I think that's like one of the foundations of public health is to get other people to carry the message. So like VJ talked about, utilizing elders in the community to try and encourage individuals to trust the vaccine process and to be open to getting a vaccine. I think the same thing is true in workplaces. When leaders take vaccines, people on the staff begin to feel confident and are willing to go out and get a vaccine themselves. And so then it's kind of this, peer pressure, if you will. Everybody begins to buy in. And so then the whole team gets protection.
Yeah, and if I might, I would agree that it's appropriate for us all to engage as advocates and to educate reticent individuals, because I think a lot of it is just the misinformation. They're just afraid. I know that in the transportation industry, there are lots of truck drivers who are very reluctant to get vaccines, any vaccines. They don't think they need it. But we have been, as a labor union, a large labor union, we've really been pushing the issue. And my group actually developed an awareness level training program on COVID-19 that we push out virtually, and all types of handouts and other types of materials just to advocate for getting vaccination, because that's the only way we're going to turn the corner and move on from this pandemic. So I very much agree with the other panel.
So I'm going to check the chat box. And while I check it, Enrique Sanchez Rivera, who's on our board, mentioned that there's an mRNA video about how vaccines work, which was made in conjunction with the Yale School of Public Health. And so we're going to share that link in the chat for people to look at afterwards. It's a very detailed video. It provides a lot of additional context. So again, another way to learn more. I think one of these questions, VJ, you kind of answered when you started talking about boosters. We have all now heard about mutant variants or mutant virus strains. And so some folks have mentioned they were reticent to get the current vaccine because they weren't sure, does it protect against the South African variant, the UK variant? If I get a booster now because I got my 2 Pfizer vaccines, am I still at risk for a different version of COVID?
The answer is we don't know. That's the honest answer. We do know that the current vaccines provide significant protection against the British strain. It's a little bit different between the Brazilian and South African strains. I've seen some conflicting data on that, where there is some protection. It's better than nothing, but it may not be the same protection as you would get with the current strains. You know, there's now a New York strain, there's now a California strain. This is just like any other virus. It is going to mutate. And the way you stop the mutations is you prevent it from getting into a host. And that's what herd immunity is, you know, it has to jump from person A to person B. If person B has a shield, which is their vaccine, it can't jump to them. So if it can't go anywhere, that's how it dies off. So yeah, there's going to be mutations. I suspect that's why we'll be doing yearly shots. But as the number of people that are vaccinated and the herd immunity comes up, even if there are mutations, it's going to be harder for it to find a host to mutate into. You need, you know, I'm a horrible gardener, but if you don't have fertilizer, water, and all that, it's not going to grow. And it's the same thing for vaccine. They don't live in the wild. You know, there was this first thing that it could live on substances for a week. That's not the case. I mean, it really needs to go person to person.
And then the other 2 questions I think are similar, but one was, is there a risk of resuming normal activity once you've received both vaccinations when there's some doubt about these variations? It sounds like your words, and again, correct us here, is if you could get the vaccine and provide that shield between it passing from person to person.
Absolutely. And, you know, you are going to resume normal activity, but for at least a indeterminate amount of time, you're going to be wearing a mask. My unmasked exposure is to a very limited number of people. It's basically family and my office staff. And, you know, I'm assuming and hoping that my office staff is doing the same thing. Luckily, I'm in a very tight-knit office. When I'm out with other people I don't know, I am wearing a mask, and you know, you will continue to do that. But getting the vaccine right now really is the right answer. You know, and the question I would actually ask is, in your communities, what barriers are you truly seeing from people not wanting to get the vaccine? because you guys are all leaders, what are the people that you work with actually saying? Those are the questions I'd like to answer.
Yeah. I mean, and speaking for me, but Don, I'll turn to you next as well. So many of my team members, so I have janitorial workers and security guards, they're reading misinformation on social media about how much it's going to hurt. They were misclassifying the Tuskegee experiment and believing that there was a different vaccine for African Americans than Caucasian Americans. So they really didn't know the truth about the vaccination process or the rigor of studies. And so a lot of people's fear is that they are going to get sick or get COVID from getting the vaccine.
I can tell you my arm hurt. And I did not feel good for a couple of days.
Mine did too.
Yeah, I can tell you that for a fact. And, my little sister, who is also a physician, it put her out for 2-3 days. But I think a lot of that had to do with the exposure. Social media is tough. I mean, and I have 2 teenagers, and if it's on TikTok, it's real. I don't have an answer on that one. You try, and the way I've done it is hopefully the people that are talking to me trust me. They trust me more than what they're reading on Facebook or Dr. Google. And I've been kind of using that approach. And I have enough personal experience that I can say, look, this is what happens if you don't get the vaccine. And Williamsburg's a relatively small community. So I can say, do you know so-and-so that lived down the street from you? Their loved one passed away, or they're stuck in the ICU for 60 days. And that is getting out in the news are all the people that, didn't pass away. But these were healthy 40 and 50-year-olds that are now most likely permanently disabled because of from recovering from the vaccine, or it's not recovering from the vaccine. They're disabled because of the effects of COVID long term.
I would say, Stephanie, I probably have hassled my groups so much that they don't come to me with misconceptions anymore, because they know I'm going to, come back and say, this is completely false. And where did you get this information from? But I'll have to admit, I had to laugh. Your Facebook memories pop up. And so one popped up maybe about a week ago, and it was from a year ago. And I was getting ready to go to church. And I was like, listen, I'm telling you right now, I'm not shaking anyone's hand. I'm not giving anyone a hug, because this virus is real. And I vividly remember the day that I posted that, because I ended up going over to a friend's house that afternoon. And the friend said to people, you all should stop teasing Dawn about, her decision to not shake anybody's hand and all that. Because, Dawn is out here in this infectious disease work. Like she's looking at what's coming out in the news, and she's reading the papers. And so I bet you what she's saying probably has some truth to it. And sure enough, a week later, everything got shut down. And so I think I've created this network of people who no longer come to me with stuff. They now come with questions of, well, if I get this vaccine, have you heard anything that may be a side effect, or can you help me find this particular vaccine because my doctor said I need this. So that's probably the language I hear more. And I'm biased because I've created a bubble of people who won't come to me with other stuff.
We were actually up in DC, our kids, I think it was a birthday present for one of our kids. They wanted to go to a concert. And I think that concert was at the end of January, early February last year in DC. And we were just hearing about COVID getting over toward the East Coast. We heard about it kind of the West Coast a little bit. And we were in Chinatown because concerts are there. And I was telling my wife, I go, this is probably the last concert we're ever going to, at least for a short period of time. And we got home, and about a week or two later, everything shut down.
So I want to hit our rapid fire questions. You answered the first one already, which was asking if there would be annual vaccination. So it sounds like we're going to keep on this path. The next one is about schools. And so, Don, I think it's for you really. And the big thing is the CDC recently updated the return to school guidelines. So now they're saying that the transient nature of the virus, such as no vaccine being approved for persons under the age of 16, the risk of children not wearing masks, or now I've heard in elementary schools, kids were trading masks back and forth, playing outside together. It seems like it's still risky for kids to be in school. So how do we get comfortable with kids going back to school? And what kind of research is being done for the mutation of the virus or transmission in schools?
Right. So I think comfort levels are very personal. I'm going to say that first. And I will tell you that in August, I was opposed to children returning to school. At that point, vaccines weren't available for teachers. And so I just felt the whole scenario was somewhat risky. I can tell you now in March, I am an absolute advocate for children returning to schools. I think that for their mental and emotional health, being around their peers is important. They need to release energy. And so I think children need to be in school. I would say this, that the CDC guidance, I encourage you to go to the website because there's some caveats with it, right? So elementary school students, whether they're in a community that has low transmission or high transmission, all of them have been recommended to go back to school with this 3-foot distance. When you get into middle and high school students, particularly high school students, that changes a bit, right? So it's based on community transmission. It's not just everybody's 3 foot. If there's high levels of transmission in the community, then we're talking about 6 foot. The other thing is, in all of these scenarios, there's the expectation that children and teachers and staff in schools are all wearing a mask. The research is ongoing. I can tell you that I've not done a lot of research into pediatric transmission, but we do know that in the cases that we've seen, the disease is presenting differently, less severely in most instances in children. And so I think that children need to go back to school. I think we need to consider mental health as much as we consider physical health in this scenario. And I think as long as teachers have been given the opportunity to get vaccinated, I think it goes right back to what Dr. VJ said. As long as children have been given, teachers have been given the opportunity to be vaccinated, then I think everybody needs to go back.
And so then, BJ, this one's for you. Should we be concerned about the long-term impact of the masks we're all wearing on our heart and lung health?
Nope. Period. I don't know how to hide my emotions at times. I had a 20-year-old kid who had some very mild asthma that I don't even know why he was in my office, because I usually don't get mild stuff. He would come in, and every time he'd talk, he'd pull his mask out because he can't breathe. And I said, put that mask back on your face and grow up. LaMont probably has 100 of people, thousands of people he works with that wear a mask all day, every day on the job site.
Mm-hmm.
There are people that have been working in hospitals for, hundreds of years wearing a mask from the minute they walk in to the minute they leave. It's not going to hurt you. Not these masks that we're using. I mean, don't put anything crazy in it, but a normal 3-ply mask or anything of that sort, it's not a problem. When my patients come in with true lung problems and they go, I hate this mask, I can't breathe, I go, yeah, but you'd be dead without it. They'll wear the mask. So yeah, there's no problem. You're not going to have any problems with it. And actually, interestingly, if you look at elite athletes, what do they do to strengthen their heart and lungs? They exercise with masks. They wear these like restrictor masks, and that's how they actually get their heart and lungs stronger.
And then, Don, this is a question that I know could be a whole different discussion, but the impact of social distancing on mental health.
Right. Perhaps we should be concerned about the long-term impact, but I think I would kind of agree with Dr. VJ, like the options of not engaging in social distancing or physical distancing, because we can continue to be social in various ways. I think the impact, would be great. And so, yes, it may have an effect. Some data has shown that there's definitely an uptick in anxiety in adults between 2020, what we see in 2021 versus what we saw, a couple of years ago. But I think we'll return to normal. We've seen other crisis situations where in the immediate aftermath, there was extremely high levels of anxiety and other mental illnesses, or not even mental illnesses, but increased mental distress. And then there's a leveling out. I think it'll be the same thing.
And honestly, if you look in children, in middle school, teenagers, high schoolers, and college kids, they're all sitting in the room talking to each other on their phone anyway. It doesn't matter if they're, 3 feet apart, 6 feet apart. They're even in the same room, they're still just talking on their phone, so it doesn't matter.
And then should we also, and Lamont, this one is directed to you. Do we think there's an impact on social pressure to prove you've been vaccinated? And the different limitations on access because some folks have not been able to get vaccinated?
At this point, I don't see where there's been a lot of social pressure, at this point. But I think that as we move forward and more people are vaccinated, I could see, there being, some type of people. I'll put it this way. I know people who've been vaccinated, fully vaccinated, who've laminated their vaccination cards and they're carrying these with them. So I think that, certain people are at least anticipating that there may be a need to be able to prove that they've been vaccinated. So, I think that's going to be something that's real as we move forward.
So then, I think for these last two, and then we're going to go to the open forum. Last year, we saw a dramatic rise in delayed health treatment of other conditions. So preventative measures, surgical procedures, elective procedures being delayed. Do you believe this is another impact that would affect communities of color? And Dr. Vijay, I look to you because I don't know how much elective work is in pulmonology and if people have delayed appointments.
We actually have, and we actually, for instance, we just opened my office back up to routine in-office visits. Most of them were virtual for a while. You could actually request to come in and you could, but right now we're in office unless it is requested virtual. And we're seeing people that typically we would see every 6 months. We haven't seen them in over a year. And this is for routine stuff. I do a lot of lung cancer work. I, on average, and this is sad, but I, on average, typically diagnose 100 to 150 lung cancers a year. Last year, I only diagnosed maybe 40. Lung cancer didn't disappear. It's just people haven't gotten their scans. They haven't gotten their routine stuff. When things start opening back up, I'm expecting to have to, I'll be seeing double that amount. So yeah, there's a lot of stuff that's being missed, and there's a lot of stuff that you miss virtually. I had a gentleman the other day who I've seen probably every 3 months virtually, and he came in the office and I was like, oh my gosh, you're losing a lot of muscle mass in your leg because, you're not seeing that on a camera.
So this one, you just gave us a sad cancer story. So I'm going to give you a fun one. What is your favorite organization that we can partner with that has been supporting pandemic work or supporting communities of color?
What's up for me?
Yes, because you made me cry. So.
Anybody and everybody who's willing to go out there and help. And, I'm a big fan of the local small grassroots organizations. If you want to partner with someone, go find your local church, go find your local social organization. That's where you're going to make the best benefit at our levels. It's great to try and do stuff on a national level. Like I've worked with the American Lung Association. many, many years, to the point where they've been trying to get me to come up to DC to speak. But I find I can actually do more benefit working in the local community, working with the local employers, the local service organizations. Create your own, we got the kids out there, just helping people register. And the registration thing is going to go away. I actually do not think we'll be requiring registration probably in a month. I think in a month from now, 6 weeks from now, you're just going to go in your doctor's office and just say, I want the vaccine and get it. But you don't need to partner with a big, massive organization. Find one in your community where you can help people. You all know who they are, and go there.
And LaMont, any groups that you're focusing on or partnering with during this time?
Well, yeah, again, I would agree with Dr. VJ, and I can say that, the local groups, there's some organizations that support the homeless in particular. We have a large homeless population here in Washington, DC, and they need a lot of help. So the organizations that provide support to them. And I have to say, as a member of Alpha Phi Alpha fraternity, I personally work closely with my local chapter to get out and do some community service on these kinds of issues. Yeah.
And Don, what about you?
Yep, I would have to agree with both Lamont and Dr. VJ. I would say that for me personally, I've been trying to push the message in the local church, trying to just educate people and encourage people to be advocates within their own circles. And so that's just where I've elected to spend my energy at this point. But I think any local organization that's doing the work is definitely worth investing in.
So our last question is more of a look forward, fingers crossed question, but what are you guys looking forward to the most post-pandemic? And I think we've all said that COVID will continue to exist, but BJ, you brought up a good point that maybe one day we won't all have to wear masks everywhere we go. And so what do you look forward to when we're there, wherever there is?
Personally, for me, traveling on a commercial airplane, going to see different places, country, meeting other people. It's not the same watching it on a YouTube video and traveling. I'm a first generation immigrant. I moved here when I was young, and I've traveled. Traveling has been in my family's vice for many, many generations. So to be able to travel to other parts of the country, to other parts of the world, enjoy eating in an outside restaurant and meeting other people that that are not in your bubble. That's what I'm going to enjoy.
Lamont, what about you?
Yeah, I thought about this quite a bit, and I would really like to see, as we get post-pandemic, I'd like to see equity in the availability of healthcare for all people in this country. I really would like to see people have access to healthcare. I think this pandemic has really revealed the gaps that exist in the country. I'd also like to see expanded support for mental health treatment, because this pandemic has taken a tremendous toll on us. Our kids probably will, recover a lot easier than some of the older folks, but, we've experienced, illness, death, financial burdens, uncertainty, and there's going to be a growing need for professional treatment and support. I'd like to see frontline workers who've played such a critical role in keeping our supply chains open and keeping our economy moving forward receive the respect and recognition that they deserve. And I'd also like to see, and this is a really important one to me, the last one is that I'd like to see increased respect for the scientific community. The scientists are the ones who are getting us past this thing. They're providing us with the tools we need, to get past this pandemic. And we need to remove as much as possible politics from science. So those are the things. Last, I'd like to be able to visit my family. I've got some elderly parents I haven't seen in over a year. Once I get my second dose, which is next week, a couple of weeks later, I'm gonna get by to see them. So those are the 5 things I'm really looking forward to seeing happen post-pandemic.
And Don, what about you?
Yeah, I think on a personal level, I want to go out to hear some live music with friends who I've had to be distanced from. And my family's big on barbecues and playing cards together. And so I'd like to be able to do that with a great deal of ease one day soon. And then when I think about community, I hope after this that we will value one another a lot differently. And that we'll also value our health more. And in valuing our health more, I hope we'll understand the importance of just taking some time to rest. We live in a society that is on the go constantly. And I hope this time of pandemic has showed us that we can actually slow down. And if we need to stay home, we can stay home and we don't have to run ourselves ragged.
Okay, Dr. VJ, got one question slipped in under the wire. It is, if a person is fully vaccinated, can they spread the virus to people who are unvaccinated?
We don't have a complete answer on that. We're thinking with the Moderna and Pfizer vaccines, the chances of that are significantly less. I'm not going to say it's 0, but it's significantly less. That's part of the things that are still being looked at in research. Something actually just came out, I want to say within the last week, where they're thinking that, especially with those 2 vaccines, the chances of transmission is, I'm not going to say none, because they have had people that have been vaccinated still come down with COVID, but it goes down significantly. Let's take flu for an example. You get the flu shot, you may still transmit the flu to someone else, but your transmission period, instead of being, we'll say 5 days, may go down to a day or 2 days. So that's what we're expecting to happen with these vaccines. It will decrease the ability to transmit the virus to someone else. It may not make it 0. It'll make it, for sure, it's going to decrease the duration of time that you could be transmitting the vaccine. And hopefully it decreases the amount of virus that you're shedding.
So I just wanted to thank each of you for your time today. This has been, I can see the many camera faces, a very engaging discussion. So many questions that we had got answered. Just so much, I guess, constantly evolving medical information that was shared. And so thank you, each one of you. I'd like to thank the audience because you kept the questions coming, and that was really great so we could engage in real time. And then a reminder, as Dr. VJ said, that the CDC.gov, that's everything and everything. They're putting out new studies, they're putting out updated information, new guidance. I think even this morning, additional travel guidance was issued. So we've just got to stay in sync with that and continue checking for the latest and greatest regulations, guidelines, and recommendations. So I'd like to thank every single one of you and have a wonderful evening.